So Bill's done two things. So 2017 did a walk, raising awareness. That was nothing compared to what he did last year, which was paddle the Murray River, 2,200 kilometres over 42 days, raising pretty much close to $100,000. So I'll let Bill tell you about his journey, but we're glad to have someone with that IPF talk to us about what that disease means for him.
Thanks, Sam, and thanks for the opportunity. And yeah, I'm really keen on when they're starting phase 1. My name is Bill Van Nierop, and I have idiopathic pulmonary fibrosis. And I've got to tell you that having lung disease in Australia is a pretty lonely place sometimes. Today's a landmark for me because it's actually the first time in 4 years that I've stood in a room with enough people that actually know what IPF is and understand lung disease. So let me say from the outset, I am absolutely stunned that a disease group that is responsible for somewhere between 16 and 20,000 deaths of Australians a year gets no mention anywhere. But let me just tell you a little bit about my story. And my backing slides are simply some pictures of a majestic Murray River that I kayaked down last year. Yeah, it was 42 days and 2,200 kilometres. I just want to talk briefly about the diagnosis that changed my life. Glenn's gone, but if he's looking for an extra set of lungs, I got a couple, but if he wants to swap. The early days, a private strategy I had, living with IPF because it's a bit of a challenge. Why do I do things like kayak down the Murray or head off and walk 700 k's in 15 days when I could probably be spending quality time with my family? And what does the future look like? And I'm hoping AdAlta is going to help with that. I was diagnosed quite by coincidence. I think, as Glenn said, that I'd noticed that swimming had become a little more difficult, but I put that down to age. I really had no visible symptoms. I had no internal symptoms that I was aware of. I had an X-ray for a bout of pneumonia, and then a very alert radiographer picked up some shading on my lungs, suggested a CT scan. And I don't know about you, but when I have a CT scan at 9 o'clock in the morning, and my doctor's receptionist gives me a call at 11 and said, "Doctor, would like to see you fairly quickly," and she's made an appointment tomorrow, I was guessing we weren't going to have champagne and salmon and talk about really good results. It actually took from the 13th of March to the 7th of April to get a definitive diagnosis. In fact, I had to have a lung biopsy. I went through the panel that he talked about. And in Australia, that's quite a concerning period of time because there is no support for people waiting on a prognosis for lung disease. And if you use Dr. Google, he's a pretty scary person. And when I read Dr. Google, he told me that I had about 3 years to live and that most people didn't survive more than 2 with a diagnosis, following diagnosis. I eventually sat across from my physician, who gave me 3 books, explained to me that I had less than a 50% chance of making 3 years, less than 20 of making 5, and reinforced the fact that most patients diagnosed with IPF lost their battle in the first 2 years. And no, there was not a lot they could do. We'll monitor you, monitoring meaning we'll check the progress. One book was about just confirming IPF. I can't remember the second, I never read it. And the third was palliative care, which I'm not really sure I'm ready for. I just kayaked 2,200 k's, so I think I'm a long way from that. So I didn't accept all of that. I asked for a reference to a guy by the name of Dr. Peter Hopkins over at Prince Charles, and he got me. And they said he won't see you for 5, 6, 7 months because there's no rush, there's nothing we can do. But Peter got me in quite early, and I was fortunate enough to finish up on compassionate grounds on nintedanib. So I've been through both. If anybody wants to know the side effects, talk to me. So I guess it was an interesting time. It became even more interesting when I headed out to tell people what I had. And if you sat down with someone for morning tea and said to them you had idiopathic pulmonary fibrosis, by the time you'd explained idiopathic pulmonary and fibrosis, it was lunchtime. And they were still no wiser to what you had. And immediately I walked into this stigma that's attached to lung disease. it's not about empathy and care for somebody with a disease. It's the opening statement is, so you're a smoker then. And my question is, what does cause have to do with it when somebody already has the disease? And a bit of empathy and understanding probably wouldn't go astray. So I decided with that to tackle it quite privately, because I really did get sick of going through the exercise of talking about, I did smoke back in the 70s, but a lung biopsy said there was no evidence on my lungs I'd ever smoked. And really, I just got tired of it all. But after 5 or 6 months, I thought perhaps maybe we shouldn't just accept this in Australia. The other thing I found that there was a total lack of awareness and understanding in the community about lung disease in general and IPF. If you want to put it in perspective, there's a guy by the name of Neil Danaher that's done an incredible job with motor neurone, and we lost a very good friend from motor neurone, so I understand it. But there's 2,000 people with motor neurone in Australia, and everybody in Australia knows about it and knows about Neil's cause. There's over 10,000 people with IPF, and nobody's ever heard of it yet. It's the work that people like AdAlta and others are doing. And in fact, there is still 30% misdiagnosed, we believe. They're just photos from the river. What's it like living with IPF? Well, there's two things that go with IPF. One is the drugs, pirfenidone and nintedanib, and the side effects. Interesting, my doctor spoke to me about the side effects first up, where to me what's important is my life. What's important to me is seeing my grandkids grow up. Not this 3 to 5 year prognosis that I had, but what can be done to help me do the things I want to do with my life. So I didn't accept it. Nintedanib, yep, you get diarrhoea. I mean, my wife and I travelled through North America. The upside of that is I can say toilet in Spanish and learn to push people out the way if I'm really in a hurry. But we managed it. And pirfenidone, to be honest, I can't remember waking up without nausea. I'm susceptible to whatever's in them that causes nausea. But that's life. The other alternative's not overly flash. And if you want to know what I mean about nausea on a scale of 1 to 10, it's 18. It's almost debilitating. My wife says it's a bit like morning sickness. I can't answer that, but she only had that for 8 months or whatever. So living with IPF is a challenge, and you live with this stigma. So I decided in 2017 to do something about it. In 2016, I came down and did the City to Surf with my wife and raised $16,000 for research. I heard Hugh talk about this morning about money for investors or money for charities, but I've got to tell you, Lung Foundation in Australia were the only people that gave us a voice and the only people that would give me information and support as a patient with lung disease. So I'm quite proud to do that, but I'm right with you guys. After that, I thought, well, this fundraising can't be that difficult. Let's get noticed. So I put together a long walk around New South Wales, and we walked 700 k's in 15 days, which is, if you work it out, just over a marathon a day, with about 58% lung function, and talked to a lot of groups and raised $100,000. And every group I went to, I found a total lack of understanding around lung disease. But I also found people with IPF sitting around in rural Australia. And if you think it's bad in the cities, it's even worse in rural Australia. On my second night, I sat with two people, a woman who had it and a woman whose husband had just died from it. So it's quite prevalent, far more prevalent than we think. And then we went for the big one last year. I thought if we can do that, we'll go a little further. And for some reason, I decided to kayak down the Murray River from Albury in New South Wales to a place called Wellington in South Australia, which is a distance of 2,200 kilometres, and my lung function now is between 50 and 53%. There's a fundamental difference between walking and kayaking, particularly aerobically, which I hadn't really picked a bit in training, but I didn't pick when I headed out each day. You can train to kayak, but you cannot train to go out and do 60 k's a day. I had an old schoolmate with me in a tinny with a 60 horsepower outboard on, who will tell you how tough the journey was, sitting on a big soft seat in a tinny down the Murray. The challenge for me was initially physical, because IPF hits you first thing in the morning. and you get breathless very quickly, and you have to push through that. And when you're breathless and can't get air in, then your muscles, doctors can explain it far better than me, but your muscles scream out for oxygen and it tends to hurt a bit, but you push through that because you've got a long way to go. And then again in the afternoons. And then after 2 or 3 weeks, IPF is quite a strong adversary to have to tackle on a daily basis. It comes at you through your mind. And I would start to think to myself, wow, I've done 1,000 Ks, I've done 1,200 Ks, I've done 1,400. If I stop now and stop going through all of this pain, the world will smile on me favourably. 1,000 Ks is not bad for somebody with 50% lung function. But then I would think about the obligations I had, because I've come across so many people in this IPF group over the last 4 years. Christy rang me 3 weeks out before I left. Her mother had passed away 2 weeks prior from IPF, but her mother had watched the long walk the year before and had said what a boost it gave her, because somebody was finally standing up and talking about IPF in the community, and to hell with what the world thought. If you think I'm a smoker, you think it, but it's idiopathic. And Tracy, who told me that her father had died within 18 months and got no support. I was thrilled to see Glenn this morning, because not all people in the medical fraternity support IPF the same way he does. Trust me. And then there was Thomas, who was 9 years old, who donated $5. And he simply left a message that said, since I lost my mum to this awful lung sickness, it's the greatest cause ever. We are real people out there in a country that does not look upon IPF and lung disease. So that's why I do what I do. The long kayak itself, wow, 2,200 Ks. Wasn't quite sure of the enormity until we paddled on the 10th of August out of Albury. And sadly, there are mileage signs on the river every 2 Ks. The upside is that campers and tourists have flogged half them. But as we got round the corner, there was this sign that said, and it's from the mouth to the mouth of the Murray. It simply said, the big blue sign said 2,227. And we drifted for a minute, and my mate, calls me William Robert, because my mother used to when she was angry, which was often, and he called me that at school because it annoyed the hell out of me. And his voice simply said, looking at 2227, well, William Robert, we got this one beaten. And I guess 4 weeks later, I heard the same voice over my left shoulder say, William Robert, welcome to Wellington, you've done it. And that was an amazingly emotional time for me. We talked to groups on the way. My role, I see it as, I have 2 choices. I can sit at home and garden and look after it, because I get breathless. I have bad days. Not every day is a happy day when you have IPF. Or I can get out and try and change the world in a small way. IPF doesn't have any champions that have a high profile. It's just ordinary people like me to come and talk to groups like you and tell you what the opportunity is there. We talked to Rotary, we talked to other groups, and we met some amazing people along the way. And we even stopped and were able to get messages. The good thing is my boss couldn't get me, because your phone doesn't work on the river, it works off to the side. Sometimes, or so he believes. We got to over 800,000 people through the media and talked about IPF. We met with Sam in Echuca, and were very pleased with the support, and others supported us along the way. We had a wonderful team. So what is and for the first time ever, we got onto national television. You think, so what? A disease group that kills 20,000 people and television's not interested? We don't get Lung Health Day at the AFL or the NRL or the tennis. There's 120 breast cancer nurses around Australia, which reflects the incredible job the McGrath Foundation has done. And there is 1 respiratory nurse in Australia. And there's 13,000 people diagnosed with lung cancer every year. There's 1,200 to 1,500 diagnosed with IPF, add another 30% for misdiagnosis, and there is 1 nurse. Because we cannot get the momentum. That's why it's so important, and a landmark for me to be in a room hearing people talk about it. What does the future hold? My wife's pretty interested in that. She thinks I should take a rest. And I guess there's some merit in that. But I can't. Look, I'll be quite honest and say there are some days I grow weary of the fight, because it is. One of the side effects of this, as I said, is the nausea and fatigue. Fatigue is enormous. I can't remember a day without fatigue. But you can't give in to it. For 15 days of the long walk, this thing threw everything it had at me, and for those 15 days, I'm pretty pleased to say I beat it. And for 42 days on the Murray River, it excelled itself and came at me again. But for those 42 days, I beat it. So I look forward. I have a message that you've got to drive yourself a bit, and on those days on the river when I was finding it a little difficult, I would simply say to it, not today, not tomorrow. Not until I've done what I want to achieve will we ultimately have our discussion. You won't lead me into the darkness easily. And I intend to hang around as long as I can to see the people like AdAlta bring something along. And I hope that today will help bring that along. I don't do this well all the time, as my wife would tell me, but I try and live by a simple adage that says don't wait for all the ducks to be lined up, don't wait for everything to be perfect. Don't wait for the storm to pass, learn to dance in the rain. I have, because I know when you can't breathe, nothing else matters. And there's a huge challenge out there in changing community understanding and awareness and the stigma. And I think having a group like AdAlta bringing something along that can eventually stop this. I'm also pragmatic enough to understand that whatever we decide from here today may not benefit me, but it may well benefit those that come behind me, and that's important as well. My name is Bill Van Nierop, and I have idiopathic pulmonary fibrosis, and I'm up for the fight. I ask you to join me.
Does anyone have any questions for Bill? Ryan.
I have a question about the nausea. That's obviously a big problem for you.
Yep.
Have you ever been given something for
Yep.
the nausea, like 5-HT3 antagonists,
Yep.
Navaban or something?
I've got ondansetron,
Yeah.
I've got ginger tablets, and it's different between the Tenadib and pirfenidone. With the Tenadib, ondansetron handled it. With pirfenidone, I need to know an hour in advance I'm going to get it. It tends to really hammer you, but it's more debilitating.
Do they help at all, the antiemetic drugs? Drugs?
If I get it early enough.
Ondansetron, yeah.
Not so much.
Yeah, okay.
But there's no gain without pain.
No.
Any other questions? One couple over here.
What's your next public challenge?
My wife's not here. I refuse to ride a bike. I've sold the kayak. I think I'll walk again, and I'm looking at upping it to 800 to 1,000 k's, where I can get to 20 odd towns and whatever, and maybe we'll do it in Western Australia. Depends on this.
Yeah.
But yeah, it gives me a focus, and as I said, to get the story out, it's only ordinary people like me can do it. There's no high profile people out there.
Just one more question.
So, Bill, you've got limited lung function, and you've really pushed yourself physically. Do you feel like that physical exertion is supporting your lung function? Is this a part of the reason you're doing this, besides obviously exposing the disease to the Australian public? Do you feel like there's anything there that in this physical exertion that's helping your the disease?
It's probably the mental side of it. Early on I did research. There's anecdotal evidence that exercise will help. It won't stop it, it won't cure it, but it makes me feel better as well. I walk 9 k's a day at home. It's tough.
Yeah.
It's the breathlessness,
Yeah.
but it makes me feel better mentally. And I think I'd like to think that it's helping along with the drugs to hold it. You clutch at a lot of things.
Yeah.
Great.
Thanks very much for the
Bill.
opportunity.
Thanks.